Hello and welcome back to the Health Evolution channel, where we bring you valuable information on health and wellness. In today's video, we'll be discussing the topic, what if signs and symptoms of malaria didn't exist? What is malaria? Before we explore the signs and symptoms, let's briefly understand what malaria is. Malaria is caused by a parasite called Plasmodium, which is transmitted through the bites of infected mosquitoes. Understanding the signs and symptoms is crucial for early detection and prompt treatment. While the disease is uncommon in temperate climates, malaria is still common in tropical and subtropical countries. Each year, nearly 290 million people are infected with malaria and more than 400,000 people die of the disease. Once inside the body, the parasites multiply in the liver and infect red blood cells, leading to various symptoms. Malaria can present with a wide range of symptoms which can vary in severity. Here are the most common signs and symptoms to watch out for. One of the hallmark symptoms of malaria is a recurring high fever. The fever often follows a cyclic pattern with chills and shivering accompanied by a rapid rise in body temperature. These fever episodes can last several hours and may occur every other day or every few days. Malaria can cause extreme fatigue and weakness, which can significantly impact a person's daily activities. The combination of fever and the body's response to the infection can leave individuals feeling exhausted. Malaria can also cause severe headaches, often accompanied by body aches and joint pain. These symptoms can make it challenging to carry out regular tasks and can affect the overall quality of life. Some people with malaria may experience gastrointestinal symptoms such as nausea, vomiting, and diarrhea. These symptoms can lead to dehydration and further weaken the body. Profuse sweating, especially during fever episodes, is another common symptom of malaria. The intense sweating often follows the period of chills and high fever. While the previously mentioned symptoms are the most common, it's important to note that malaria can also present with less common signs, including jaundice. Malaria can sometimes affect the liver, leading to a yellowing of the skin and eyes, known as jaundice. This occurs when the liver is unable to effectively filter waste products from the body. Malaria can also cause a decrease in red blood cells, leading to anemia. Symptoms of anemia include fatigue, weakness, pale skin, and shortness of breath. In severe cases, malaria can cause acute respiratory distress syndrome. This can result in breathing difficulties, rapid breathing, and a bluish tint to the skin. If you or someone you know experiences any of the aforementioned symptoms, especially after traveling to or residing in a malaria endemic area, it is crucial to seek medical attention immediately. Early diagnosis and treatment are essential to prevent complications and ensure a speedy recovery. To reduce malaria infections, World Health Programs distribute preventive drugs and insecticide-treated bed nets to protect people from mosquito bites. The World Health Organization has recommended a malaria vaccine for use in children who live in countries with high numbers of malaria cases. Protective clothing, bed nets, and insecticides can protect you while traveling. You also can take preventive medicine before, during, and after a trip to a high-risk area. Many malaria parasites have developed resistance to common drugs used to treat the disease. Malaria is a deadly disease that affects millions of people worldwide. So let's imagine the impact it would have if its signs and symptoms were absent. In our hypothetical scenario, let's imagine a world where the signs and symptoms of malaria simply didn't exist. One immediate consequence would be the absence of early warning signs. Normally, symptoms like fever, headache, nausea, and muscle pain prompt individuals to seek medical attention, leading to early diagnosis and treatment. Without these indicators, people infected with malaria would remain oblivious to their condition. This lack of awareness could allow the parasite to progress unchecked, leading to severe consequences for infected individuals. Malaria can lead to life-threatening complications, particularly in vulnerable populations such as young children and pregnant women. Without the ability to recognize the signs, treatment delays could result in an increased risk of severe illness and mortality. Besides the impact on individual health, the absence of visible symptoms would also have significant implications for the transmission and control of malaria on a global scale. Malaria is already a major public health challenge, particularly in regions with high mosquito prevalence. In our hypothetical scenario, the silent transmission of the disease will become even more rampant. Mosquitoes would continue to bite and infect people, but with no visible signs. Infected individuals would unknowingly become reservoirs of the parasites, capable of spreading it to others. This scenario could lead to a surge in malaria cases, especially in areas already struggling with control efforts. Additionally, the absence of symptoms would hinder malaria prevention and control measures. Currently, individuals in endemic regions are educated about the signs and symptoms of malaria, enabling them to take preventive actions such as using bed nets, applying mosquito repellent, and seeking medical care promptly. Without the awareness of symptoms, people may neglect these preventive measures, inadvertently increasing their risk of contracting malaria. This lack of vigilance could disrupt ongoing efforts to control the disease, such as mass distribution of bed nets, indoor residual spraying, and public health campaigns. On a positive note, the absence of symptoms might prompt the scientific and medical community to intensify research efforts and focus on improving diagnostic methods. In our hypothetical scenario, the urgency to develop reliable tests capable of detecting asymptomatic malaria cases will become paramount. Scientists would dedicate their efforts to finding innovative ways to identify infected individuals, such as advanced molecular diagnostics or the use of specialized testing technologies. That is all for our topic today. I hope you learned something new and beneficial, from signs and symptoms of malaria to prevention and what if the signs and symptoms don't exist. Remember, if you suspect you have malaria, it is important to consult a healthcare professional for proper diagnosis and treatment. Stay informed, stay vigilant, and take necessary precautions to protect yourself from malaria. Thank you for watching our video today. If you enjoyed it, please subscribe to our YouTube channel for more contents like this. See you next time. Bye.